My name is Pearl, and I'm with the Chinese Community Center. I am the director for the senior department. So let's get started with today's presentation. Thank you all for attending. We're really glad that you're here to join in on our session today about the COVID-19 vaccine info session, and it's going to be presented by Thomas Liu, a pharmacist at MedX Pharmacy. So before we jump right into the presentation, I do want to just go over a few things, just in case if you guys don't know how to use Zoom. Give me a second. So throughout this presentation, you will not be able to unmute yourselves. Right now we have it disabled, and that's just because that way we don't disrupt while Dr. Liu is presenting. But at the end, I will enable it, and that way you guys will be able to ask him questions about the COVID vaccine during the Q&A session. Also, as well, if you guys would like, you can also rename yourself, and that way, if you are going to talk, that way at least we know who we're talking to. So if you want to rename yourself, you can go to the participants button and then click on more, and then you can rename to your actual name. And also as well, you will not be able to enable your camera at this time. We'll enable it during the Q&A session. And during the Q&A session, we'll see how it goes. It doesn't seem like we have too many people, so I think we'll probably just enable it for everyone. And you can also click on reactions too if you just want to raise your hand if you want to mention anything. So we'll have it all available to you towards the end of the presentation. And you are welcome to, if you have a question throughout the presentation too, you can go ahead and just type it in the chat, and then we'll ask it at the end as well, if that way you won't forget your question. And before I pass it on to Dr. Liu, I did want to mention that right now the CCC, we are able to, we do have some forms up front in the front desk. And so if you want to get signed up for the COVID vaccine, and it's just a pre-registration. At this time, MedX Pharmacy does not have the vaccines quite yet, and Dr. Liu will talk a little bit more about it. But we do have some forms if you do want to sign up with us. And this vaccine is not just for CCC community members. It is available for everyone in the community. So just remember that as well. And that's it. So I just want to introduce Dr. Liu. He is the head pharmacist at MedX Pharmacy, and they're our partners that we will be working with throughout this time. And hopefully soon we will be able to distribute COVID vaccines here at the CCC. So Dr. Liu, I'm handing it off to you.
Thank you, Pearl. Hi, good afternoon, everyone. Thank you for attending our seminar presentation regarding COVID-19 vaccine today. And so in the beginning, I'm just talking a little bit about the coronavirus. So coronavirus, as everybody know, the emerged for somewhere else, we don't know where, and just popped up 2020. And really bring us a lot of uncomfortable and inconvenience, the big change for our life. And for the symptom for this virus, like right now during the winter season, you might get some flu or the coronavirus, their symptoms are really similar. So at this moment, if you have any symptoms similar to either you think, oh, this is flu, that's okay. This might be the flu, it's not coronavirus, but actually, because they are so similar, you have any symptom as the following I'm going to discuss about, I recommend just go ahead and get tests, just in case, to protect yourself, protect everybody around you, like your friends, your family, just protect them. So for the coronavirus, the symptom, you might have some fever, as everybody knows, fever, chill, cough, short of breath, and the difficulty breathing, fatigue, muscle ache, headache, loss of taste or smell, sore throat, all that stuff. So these are the symptoms that we seen a lot if you get a flu as well. So, but the only really big difference between those two, the flu and the coronavirus, is that if you get the coronavirus, you have like almost 60, 70%, or even 80 is going to lose your taste or smell. So that's a really big difference. But everything else is the same, like runny nose, congestion, headache, fever. So if you have any symptom like the one I just mentioned, I would recommend just go ahead and get tested. So it's very easy. You just go to your nearby CVS, Walgreens, that you can register with them. Just go online and then answer a little bit questionnaire, and then you'll be able to register and get a test. Or if you want, you can go to your family doctor. Some of the family doctors do provide a coronavirus test so as well. So at this moment, I would encourage everyone, if you got anything symptom, just go ahead and do the test, just in case, like, yeah, it happened. But yeah, all right. Now, next slide, please. All right. So at this moment, there's no treatment option available or any treatment guideline for coronavirus. All we can do is right now, we just treat the symptom. Like if you have fever, we give you Tylenol or give you ibuprofen. If you have runny nose, we give you some Current D or Zyrtec D to help you relieve the symptom. So there's no treatment guideline at this moment. So the really key point here is that prevention. So you see, I put 3 prevention. Prevention is better than treatment. You don't want to get it. So prevention, wash your hands all the time whenever you go, before you go to the grocery store, after you're coming out from the grocery store, wherever you go, wash your hand all the time and making sure social distance as well. And really important, mask. Wear your mask all the time wherever you go outside your house, like even in the park, or you go to like, oh, just go grocery shopping. So making sure wear your mask, that's really important. That because wearing the mask not only protect you from the droplet, but also protect you spread the droplet to everyone else around the area. So it's really important. And try to stay home as much as you can unless you have to go out. And last, the most important thing is the vaccine. So that's the key, the one we're going to talk about today. Vaccine will provide a really good prevention for you to create an antibody to fight for this virus. And right now, there's, like I mentioned, there's no treatment. So what can you do to help you prevent from the coronavirus? The most important thing, promote your immune system. Try to get some good sleep. Try to exercise well, eat well, and stay healthy and happy. So all those factors will promote your own immune system to make sure you can fight all kinds of, not only coronavirus, but all kinds of viruses like flu virus or like all the bacterial stuff. So it's just try to sleep well and then regular exercise. Like maybe if you think like, oh, it's so cold outside, so maybe going out walk for like 10 minutes at noontime. Today is kind of hot, but in the morning it's okay. Yeah, but like last week is really cold, and then you can probably go out during noontime. So a little bit walk, try to exercise as much as you can, and when you going out, exposure to sun, you will, at the same time you absorb some vitamin D for the body as well. And in terms of supplements, I encourage everyone to get some vitamin C, vitamin D. That all those will help you boost your immune system as well. And somebody have some questions, say, hey, can I take the zinc? I heard zinc doing a good job. The President Trump have the zinc when he's sick, got the coronavirus. Zinc, yeah, you can, but it's not really, there's no evidence still at this moment. But if you want and you cannot find the zinc over the counter anywhere, I recommend you can try to digest some more oyster and shellfish, red meat, and the easy one, cereal. Cereal have really good fortified of the zinc. So if you cannot get the tablet anywhere else, if you want the zinc, you can get some cereal. They will help you as well. And okay, next slide, please. Okay, now we are moving on to our main topic today, COVID-19 vaccine. So this vaccine, not only COVID-19 vaccine, but all the vaccine, flu vaccine, Shingrix, all the vaccine. So in order for the FDA to approve them, safety is the first concern for the FDA. They want to making sure everything, all the vaccine, not only vaccine, but medication as well, like before they go into the market, safety is the first concern. And so it is safe to receive the COVID-19 vaccine at this moment. And so currently there are two vaccine available in the United States. And the first one is a Pfizer one, and another one is a Moderna. And both of them are mRNA vaccine. And what is mRNA vaccine? What's the difference between this one and the previous one we received, like flu vaccine? Okay, so the old vaccine, like the flu vaccine or the Shingrix, all those are the protein vaccines. So the vaccine you receive is already made. Let me give you a little bit easier, for example. So when you go through a restaurant, okay, the server will come here, will bring you a menu, and you try to order some food to eat. So the food, like the yogurt, the milk, just whatever you order coming to you, is the old style vaccine. The one you receive is the product. For the mRNA vaccine, the one you receive from those two manufacturers is the menu. So you check the menu, okay, I want this, I want this. So this vaccine is the menu. It's going to be injected into your body. And your body will create make the protein, like the food you order, like yogurt, cereal, whatever, we make by ourselves to have the body recognize this protein to create the antibody for your body to fight for the coronavirus. So the way this vaccine is being made is a new technique. It's totally different from the previous one. And this technique is not really, I mean, it is new, but actually this mRNA technique has been established since 1990. So just because at that time we don't have good technique to provide ultra cold refrigerator like right now, for the Pfizer vaccine, you have to provide minus 70 degrees Celsius to store. So at that time, it's really inconvenient. But right now, we have all the new technique. We have a good transportation system, and so that we can have those vaccines ready for us. That's why the 2020, we have this brand new technique, mRNA vaccine. But actually, the technique has been on the market for a while already, but we don't have that. It just costs too much until last year. We need it. We need it right now. So government said, just go ahead and do it. We'll cover it. And then that's why we have the mRNA vaccine right now. And there's a really good vaccine. This feature is that, so as everybody know, there are so many different mutate coronavirus right now around the world, like UK and in the United States as well. So for this mRNA vaccine, it's really easy for the manufacturer to change it. So that, for example, so per Pfizer manufacturer, right now, if the virus mutate, they can have the new vaccine ready in 2 to 3 months. And that's really fast and really good. So that's really huge advance in terms of technology as well, so that they can bring this vaccine to the market. And for the Pfizer vaccine, they have 40,000 people in the clinical trial. And for Moderna, they put 30,000 people on the clinical trial to making sure all the vaccine are safe and effective for everyone. So that's why we see the 95% like effective, really good numbers. Okay, next slide, please. Okay, COVID-19 vaccine, is it safe? Okay, like I just mentioned, so for the Pfizer, we have 44,000 people already get injection. I mean, before they even on the market, on the clinical trial, during the clinical trial. But right now we have more than that numbers got a vaccine already. And so, and for Moderna, it's 30,000 people get for the clinical trial. So it is really safe and okay to receive the injection. So, and the next question is that should I get it or not? So at this moment, it's really benefit risk, like which one you think, okay, if I have all this condition, if I get a coronavirus, will that harm me? Should I get it or not? Because if I receive it, I might get some side effect. Yes. But if I get a vaccine and then later on, if I get the coronavirus, it will help you a lot because they will shorten your hospitality days and also your that your symptom going down a lot more. Like you will not be as severe as the one without vaccine. So at this point, I recommend everybody just go ahead and get it because it will prevent you from the coronavirus. Not only prevent you from the coronavirus, but also relieve your symptom if you got the COVID-19. Yes. So okay. So it's really up to you if you want, but I would encourage everybody just go and receive the vaccine because the benefit is way over the risk. But sometimes if you have some different medical condition, for example, I am allergic to some vaccine, should I get it? So as for now, yes, we will still recommend you to receive the vaccine because per CDC guideline, there's no limitation that who can or who cannot receive the vaccine. So I would recommend everyone just go ahead and do it, which means because the benefits way over the risk. Okay, next slide, please. Okay, so right now we are going to talk about the side effect from the vaccine. If I receive the vaccine, what kind of side effect I should expect? So this vaccine, there's no difference between this one and flu vaccine in terms of side effect. You will still feel some muscle ache, fever, chill, headache, tired, fatigue, or even the injection site swelling. So the only real difference between this one and the previous vaccine, like flu vaccine, is that because COVID-19 vaccine is from mRNA techniques, so you will have higher chance to get all these side effects. Like if you have some friends or they receive vaccine, they might complain like, oh, it's really hurt, and I really got a fever. How come I never got that before, like when I received the flu vaccine or any other vaccine? It is because the way we create this vaccine is the mRNA vaccine. So you might see more side effect from this one, but there's no huge difference between this one or the flu vaccine in terms of side effect. So yes, and so if you have any side effect after receiving vaccine, for example, like fever, so it's the same treatment. Like you just okay, I have some fever. Let me just go ahead and get some Tylenol or Advil to relieve the fevers. If I feel some muscle ache, you can use the cold press to make it not a sore. Try to relieve the sore. And then if you have headache, just go and take the Tylenol or Advil to relieve the headache. So everything is similar, just you are going to have higher chance to get the side effect. And also because this one is making from the mRNA technique, so you will have higher chance to get all the side effects for the second dose. The second dose will have stronger the side effect than the first one because the way it's being created. So just keep that in mind. You might feel you have higher chance to have all those side effects, but it's not because nothing wrong, just because it's the vaccine. Yes. All right. Let's move on to next slide, please. Okay. So the last slide we discussed about is the more common side effects, like the fever, like the chill or the fatigue or the injection site ache. That's the common one. And for this slide, I'm just going to talking about more severe. Okay, what if I still have muscle ache, like 24 hours, 48 hours after I receive the injection? At that time, I recommend just give us a call, or you call your doctor to say, hey, doctor, I got a vaccine 3 days ago. How come still have this pain? Or what happened? What can I do? So just give us a call, and then we will talk you through all that and then figure it out. And then if there's any like other more severe allergy reaction, like difficult breathing or the really rush over the whole body, then we'll call 911. So that's part of the reason we have to be careful when after you receive the injection. We'll keep you in the pharmacy or wherever we give the vaccine. You have to stay there for at least 15, probably 15 or 30, probably 15 minutes. It depends on your condition to monitor. And then if you're okay, then we will let it go, because usually all those symptoms should pop up within 20 minutes or 10 minutes. It'll pop out right there. And then if anything happens, we'll have all the EpiPen or any treatment we'll give you treatment right away and call 911. Yes, all right. And then next slide, please. Okay. So for the COVID-19 vaccine, who is going to get the vaccine first? Per CDC guideline, so it's the first phase 1A is the healthcare professional or long-term care facility residents. And 1B is patient with 75 years old or above. That's for the CDC guideline. But in Texas, we are a little bit different. For phase 1B, people 65 years old above is under 1B. And also people is 16 years old or above with at least one of the chronic medical condition like diabetes or chronic obstructive pulmonary disease or heart disease or cancer, then you will be eligible to qualify for the 1B phase. And then anything after that, because at this moment, the vaccine is really short supply. So the Texas Department have not reviewed. Asthma is one of them, the COPD. And under the chronic obstructive pulmonary disease, that's under one of them. And so any other breaths, like the healthy people, we are not sure yet. The Texas Health Department have not reviewed the new guideline for anything after this. So at this moment, we're just trying to help anyone under 1B and 1A and 1B to be vaccinated. Yes, all right. And then next slide, please. Okay, so here, this slide is some of the questions we got from a lot of people. So we'll go through each of them, but if there's any further question, you're welcome to ask the question after when the Q&A comes out. Okay, if I have been sick and recovered from the COVID-19, should I or do I need to go and get vaccine? Yes. And the reason behind that is because even though you already get it, COVID-19 and your body already give you some antibody to fight for the coronavirus, but for now, like based on the study we found out is that the patient who recover from the COVID-19 only have 6 months period or even shorter to have the antibody. That's why we still recommend everybody just go ahead and get a vaccine so that you can have longer protection. So right now, both Pfizer and Moderna are saying, oh, their vaccine have good protection for up to 1 year. For now, maybe longer. We're still under study right now. So even though you have been sick and recovered from the COVID-19, I will still recommend just go ahead and get the COVID-19 vaccine. And next question, can a person currently sick with COVID-19 receive the vaccine? No. So per CDC guideline, people right now is under COVID-19 condition. You have to wait until you're totally recover, no other symptom, like no fever, no shorter breath, no cough, all that symptom. And then you can receive vaccine. So if you have current COVID-19 disease right now, you're not sure if I can get a vaccine, just give us a call to making sure like, hey, everything's good. Okay, and based on your statement, based on your condition, then they will know if you can or cannot receive the vaccine at that time. Okay, next question is, should people who previously received antibody therapy for COVID-19 receive the vaccine? So right now, because the treatment you receive is the antibody therapy for COVID-19 vaccine. And when you got the COVID-19, so you have to wait at least 90 days, which is 3 months, to receive the new vaccine. And the reason behind that is because you already have the antibody from someone else. And you don't want to give the COVID-19 vaccine, because once the vaccine inject into your body, all those antibody will attack the vaccine, and then it deactivate actually, basically, then you will not receive protection you're supposed to. So we don't recommend you get the COVID-19 vaccine at least 9 days apart from the therapy. Okay, can I get other vaccine while I receive the COVID-19 vaccine? The answer is yes, but you have to wait at least 14 days apart to making sure everything's good. So yes, you can still receive the flu vaccine or pneumococcal or shingles vaccine, but have to be at least 14 days apart. And next question is, will COVID-19 vaccine cause me to test positive on the COVID-19 test? The answer is no. So this vaccine is only going to give you the antibodies. So to help your body create the antibody to fight for the coronavirus. So for the COVID-19 virus test, no, you will not get positive. But if you go and test like COVID-19 antibody test, then yes, you will get the test positive because you already received the vaccine. That's our purpose. We are going to have the antibody in your system to fight for the coronavirus. So for the COVID viral test, it's not going to show positive, it will show negative. Okay, will the mRNA vaccine, this COVID-19, change my DNA? The answer is no. So like I mentioned on the previous slide, so this mRNA technique is basically the menu that we are going to put into your body, that your body to create the protein, like assembling like the coronavirus, and then to create the antibody for you. So it's not going to insert into connect to your body to change your DNA. The answer is no. And next slide, please. All right. So for MedX Pharmacy, we are just right now we are just trying to help everyone to get in line. If they cannot find anywhere else to receive the COVID-19 vaccine, you're welcome to go ahead and register with us. We'll put you in line to receive the vaccine. Once you will receive the vaccine, we'll give you a call and ask you see if you receive from somewhere else. If yes, then we'll pass the spot to next person who is needed. But otherwise, you can still be able to register with us. And where can I find, where to find the information regarding COVID-19 vaccine? So you can go to the Texas Health Department. They have a COVID-19 vaccine allocation map that you can take a look. Like usually they will release the information like 1 or 2 weeks ahead. So you wouldn't be able to know like, okay, next week, maybe some HB next door to me, they are going to receive the vaccine. You can try to register with them. Or like Kroger, like all the chain store, big chain store, everybody's going to receive sometime, but we're not sure when. But you can check on that information on Texas Health Department website. And for this COVID-19 vaccine, everyone can be received for free. So what the U.S. government is trying to do is trying to make sure everybody get protected. So they want to get vaccination as many as possible. So anyone, even without insurance, you are welcome to come and register with us, and then we can give you the vaccine for free. Okay. And do they have to take both vaccine with? Okay, next question is, do they have to take both vaccine with MedX Pharmacy? So like everybody know, there are 2 separate doses for both Pfizer and Moderna. So for now, I think you have to get both vaccine with us, but I think probably because CDC did not release any information like, hey, you have to have this vaccine in the same pharmacy. But what we are going to do is that we will give you a card stamped with like, when did you receive the vaccine from which manufacturer, with a lot number on the card. And with that card, you might be able to ask like, maybe, okay, I don't have it right now, and MedX Pharmacy does not have the second dose for me. Can I try maybe HEB or Kroger? You can give that information because you are going to show them, okay, for the first dose, which manufacturer, which lot number, and when did you receive? So that's information we provide for you. So you should be able to get the second dose from them. And sorry, next slide, please. All right. Do I need to wear a mask after the vaccination? So yes, please. So right now, even though with the vaccine, so after you receive the COVID-19 vaccine, does not mean that you will not get COVID-19. It's just the COVID-19 vaccine is going to provide the antibody for yourself to fight for the coronavirus. So it does not mean that you will not get it. You still have the chance to get the coronavirus, but you have that symptom, you will shorten your hospitality day hospital. So it's better still to get a vaccine. So even though you have the vaccine, I'll still encourage everyone to wear a mask, wash your hand, keep good social distance to protect yourself, to protect everyone around you. So yes, please, to wear the mask all the time. I don't think it's going to be like maybe another couple years before everyone can take down the mask. So yes, just wear the mask, please. All right, next slide, please. Okay, how much will it cost for me to receive the COVID-19 vaccine? Okay, like the previous I mentioned, so this vaccine is free for everyone, even with undocumented people or patient without insurance. Everyone's welcome to come and then get vaccinated. So the vaccines provided by U.S. government is free of charge for everyone. But just for your information, the vaccine provider, it may be ineligible to charge you some administration fee. And so if you go to HEB, for example, they might charge you $5 or $10 if you don't have insurance. But it really depends on the pharmacy. Every pharmacy have their own rules. So you have to check with them. But for MedX, we are going to just help the community and then provide for free. So just for your information. All right, and next slide, please. And thank you everyone for attending our presentation for today. So if you are interested in sign up for the pre-registration, you're welcome to, there are three different methods actually. You can complete the online form, register with our purebright.com, or you can fill out the paper form and then submit to Chinese Community Center, or you can bring to our MedX Pharmacy on the corporate drive in Chinatown location, or you can text message the VAC to 833-595-0527, and you will receive the link for register. And thank you very much. I'll get back to Pearl, please.
All right, thank you, Dr. Liu, for giving that presentation. Now we're going to enter our Q&A session, and then give me a second, I'm going to let you guys be able to unmute yourselves, and one at a time you guys can ask the questions. But let's first start with, there were some questions that were typed in the chat. Dr. Liu, one person asked, what about asthma? Someone with asthma, do they qualify as part of the 1B phase?
Yes. So yes, asthma would be able to qualify for the 1B. Yes.
Second was, and I think you already answered this. If you get the first vaccine from one location, do you automatically get it from the second location?
There's no specific guideline for now. But like I mentioned previously, like once you receive the vaccine from MedX Pharmacy, we will provide you a card with all the information, with what time, what day, which manufacturer, which lot number, all the information on the card for you, so that maybe you can bring to other farms, maybe HEB Walgreen, if they are eligible to take that, then you can receive the second dose from there. Yes.
All right. Thank you, Dr. Liu. And I believe Ping Liu has a question. If you want to go ahead and unmute yourself.
Yes. Well, first of all, thank you for giving this talk and to educate us on the COVID-19 vaccine. I have a quick question on the side effect of the after receiving the shot. So you mentioned that after receiving the shot, the patient or the person receiving it will stay at the clinic or the pharmacy for at least 15-20 minutes to see whether there's any severe allergy effect or reaction. So my question is it usually if someone who received the vaccine were to develop a severe side effect, it usually occur within the first 20 minutes after receiving the shot? Is it possible that when this person gets home later that day, he or she might actually develop a more severe symptoms later the day? And then, so I guess it's just the timing of how soon the side effect occur.
Got you. Yes. Thank you for that question. So when we have the second call to schedule the appointment, we will have some screening question for you at that time, and then we'll decide if you have more. For example, patient have severe reaction from other vaccine, then we might need her to stay longer, like 30 minutes or longer, but probably 30 minutes only. Usually, the side effect or the allergy reaction will appear within 30 minutes. Yeah, that's what happened. You say maybe after that is rare, but everybody is different. So everybody have different reaction to all kinds of stuff. So there's no guarantee like, hey, it's not going to show up, but it's rarely see that. Usually for something like that, anaphylactic shock, like it was appear pretty soon within 30 minutes. Like even within 10 minutes, you'll see like, okay, rash all over the body or like shoulder breath or other severe allergy reaction, you'll see pretty soon within 30 minutes. Usually that's what happens. It's rarely like, okay, after 1 or 2 hours and it start to pop out. No, it's you rarely see even with other medication as well. Yeah, it will pop out really soon within 30 minutes. So that's why we have to have some emergency kit like EpiPen or Benadryl or some other emergency kit standby next to in the pharmacy. So if anything happen, we will give the shot right away and we'll call 911 for help if there's any emergency appear. Yeah.
Thank you. Sorry, I have one last question. I actually went to the website to register for my parents. They qualify for the Texas Phase 1B. I just want to know whether I would receive any email confirmation for successfully registering, or will I just wait for a call or maybe an email from your pharmacy?
I got you. So right now, because we just created a new Texas function the day 2 days before or yesterday. So right now, within 72 hours, you receive a text message from us saying, okay, thank you for registration, and then we receive your register. If you did not receive a text within 72 hours, so please give us a call. Then something might be wrong or some information missing. We did not receive your registration. So just please give us a call after 72 hours. But usually should be within 72 hours, you message from us.
Thank you very much. Thanks.
All right, before I move on to JJ, I think Abdul, could you expand on what you were asking? You said you got shingles, any side effects? Are you asking if you have shingles, like, you know, the side effects you get from the shingle shot is going to be the same as if you get the COVID vaccine shots? I don't know if Abdul, if you are able to talk.
No, I got the shingle 20 days ago in my right side chest.
Are you, sorry, Abdul, are you talking?
Yeah, I'm talking. Do you hear
Okay,
me?
can you talk a little louder? We have a hard time hearing you.
Okay. My shingle, I got it a right side chest 1 month ago. There's a pain, but there is no any kind of rush.
Is this question related to COVID vaccine in any way?
No.
If this question is about shingles, I recommend you calling back your pharmacist.
What I'm meaning is any side effect of COVID vaccine for shingle.
Oh,
Right.
This is what I mean.
okay. Sorry. Let me repeat your question and making sure I got it correct. So you're trying to ask, you got a shingle maybe about 20 days ago.
Yeah,
And are you asking like, can you receive the COVID-19 vaccine?
exactly.
Oh.
Okay, got you. So, yes, you could, but I'll wait a little bit longer after you recover from the shingle. So, which means you're not in pain or something. And also, because everyone's different, I would recommend consult your family doctor to see, okay, is your shingle recovered or not? To confirm like, okay, it's good time, you're okay to go. I would recommend just come.
I don't know when it will be. I asked my doctor, my family doctor, my CPC, told me you can take the COVID vaccine. You can get it.
Yeah, but so my point will be like for the shingle, I'll wait until your shingle really fully recover and then receive the vaccine. So right now you say you got a shingle 20 days ago. And I recommend you can consult your doctor and say, hey, doctor, do you think I've recovered already? Or I'm still have to wait a little bit. It really, because everybody's different. So I don't want to give you an answer like, hey, you can get it right now, but I'm not sure what kind of condition are you currently on. So maybe you're still in pain or you're not in pain, or what kind of condition are you currently? So that's why I say you have to contact your family doctor and then confirm with him like, okay, I'm fully recovered from the shingle, then it's ready to go to receive the COVID-19 vaccine.
Okay, fine.
Yes.
Thank you.
No problem.
All right, and JJ, you can go ahead and unmute yourself.
Hi, thank you so much for your presentation earlier. It was really helpful. My question is, do people with autism, can they take the vaccine? Are there any side effects?
Okay, for autism, we don't have a lot of study right now because, like I mentioned, because this vaccine is really relatively new. So, but as for now, there's no contraindication, which means there's no one cannot receive the vaccine unless you have really severe reaction from the vaccine, like the COVID-19 vaccine for the first dose, and then you will be not able to receive the second dose for the COVID-19 vaccine.
Gotcha. Okay.
So any people with any medical condition, everybody is eligible to receive vaccine. But for Pfizer, is people with 16 years or above. For Moderna, is any people with 18 years old or above. Yeah, just FYI for now.
Gotcha.
Yeah,
Okay.
we're going some children clinical trial right now. So we are waiting for the FDA to release some more information if the kids can receive the vaccine or not. So yeah.
Okay, thank you so much for answering the question.
All right. Does anyone else have any other questions? If you do, I think Judy, go ahead and unmute yourself.
Hi, good afternoon. Earlier you mentioned that to wait 90 days if you have had the COVID vaccine. And my question is, because there's such a high number or a high percentage of asymptomatic cases, do you recommend people getting tested for COVID before getting the COVID vaccine to see whether we have COVID or not?
Thank you for asking that question. So I don't think it's necessary to get a test before you receive the vaccine. So, and for right now, per CDC guideline, like people have symptom, and how do you define they are recovered? It's not means they are totally test negative. It's just they don't have symptom, and they are okay. So even people with a COVID-19 in the body, so you already have some immune system try to create some antibody for you, but you are still be eligible to receive a vaccine to boost your immune system to get some more antibody to protect you. So at this moment, I don't recommend, and I mean, I don't think it's necessary, not recommend. I don't think it's necessary to get a test before you receive vaccine because there's so many, like, I think it's 50 or 60% of asymptomatic for all the COVID-19 patient. So if you don't have any symptom, you don't have to do the test before you receive the vaccine. Yeah, even with the your asymptomatic COVID-19 patient, because the reason why you are asymptomatic is because your body have really good antibody, you have really good immune system to fight back the coronavirus, so you are still able to receive the COVID-19 vaccine to help you boost your immune system to create more antibody for you.
Okay. Okay,
Does
thank you.
Help, yeah. And another thing I want to mention to everyone is that currently MedX Pharmacy have not received the vaccine, just FYI. So, but we did got approval from the Texas Health Department that we are going to receive the vaccine, but we have not received the vaccine. So, and also currently we have like 1,200 people registered with us. So just be patient. So once we receive the vaccine, and we'll based on the CDC guideline and also the Texas Health Department guideline to schedule for the appointment. We'll just please be patient and wait for our call to schedule for the COVID-19 vaccine appointment. Yes, just another information. Yeah. And sorry, Pearl. Get back to you.
When we expect to get the shot?
I'm sorry, pardon?
When you expect to get the shot?
Okay, so we are not sure. So because like everybody knows, it's really short supply right now. So a lot of people we can order 20,000 or 1,000 vaccine. We try to say request for it, but they only send 100. So we are not sure how many vaccine we are going to receive. Our first batch, we receive a lot. We request a lot, but we're not sure how many they are going to send. So because like I mentioned, we have 1,200 people registered with us already. So we request quite a lot for the government. But from what I heard is that they are not going to send whatever you request because of the short supply. So just be patient with us. But at this time, you are still welcome to register with any other pharmacies like HEB, Walgreens, Kroger. If they have vaccine available, you just go ahead and register with them and then receive vaccine. You don't have, so even though you register with us, does not mean that you cannot register with everyone else. You are still welcome to register with any other pharmacy, whoever give the vaccine. Our MedX purpose is trying to help the community to have everybody get into the line if you're interested in receiving the COVID-19 vaccine. And then when we call you to schedule the appointment, if you receive, you can let us know. We can pass the spot to the next patient, and then if you don't, then we can schedule for to receive the vaccine.
But I registered with MedX.
I'm sorry, pardon?
I registered with you yesterday.
Yes, sir. Thank you
your
for
pharmacy. Yeah.
Yes, sir. Yeah. So we are not sure when are we going to receive and how many are we going to receive. So I'll encourage everybody still, like, if you want to receive the vaccine, you can still register with like CVS, Walgreens. I know a lot of couple like HEB pharmacy or Walgreens pharmacy, they got the vaccine. So you can call around, or like I mentioned to you, you can go to the Texas Health Department website. There's the COVID-19 vaccine allocation map that you can check out the list, who is going to receive the vaccine sometime next week or 2 weeks later. And then you can check it on the website, and then you'll find out like, oh, does the HEB next to my store is going to get it? Maybe they got it next week. Then you can register with them. Hey, can I be in line? Some of the pharmacy did open to register with them, but some does not. So it really depends on which pharmacy that you go and how the company policy or their store policy. But for us, you're welcome to register with us. Then we'll check with you once we receive vaccine to see if you still want it or not, or maybe you already got it. I mean, yeah.
Yeah, and just to echo off of that, like he said, we're still waiting for the state or MedX Pharmacy is still waiting for the state approval, but once they do approve, and then the vaccine will be released to us, they will be able to start scheduling people in as soon as they can, because they are ready to get it moving. They've have all the equipment ready for months now. And so they are ready to serve everyone. It's just a matter of how soon the state can issue that approval. So yeah, you guys, everyone is welcome to register at this time. You know, if you just want to get your name down somewhere, but again, like, you know, apply to as many places as you can, because right now there's a line everywhere you go. And it is just a matter of timing, like who can get it first. All right. Any other questions for Dr. Liu at this time? You know, you can see he's in his office still working. So he's taking time out of his day to really help us with this presentation and just to let everyone and just inform everyone information and just communicate with you guys. All right.
Yeah, but if there's any question later on, you're welcome to give us a call at MedX Pharmacy that we can try to help you and answer your question. Yes.
Okay. All right, well, if there are no more questions, then that concludes our presentation for today. Thank you very much for attending. We'll also be posting this recording online as well soon. You can check back on the CCC website, and if you want to just kind of go back and review the presentation later. All right, well, thank you everyone for joining us today. Hope you guys have a great day.
Thank you.
Hello.
Thank you.
Hello, Pearl.
Oh, yes.
I'm the Chinese teacher. May I register from CCC, or I need to the Dr. Liu?
If you're at CCC, there are forms up front with Helen, the front desk. You can
ask Helen. Okay.
Yeah. Ask Helen, and she'll give you the form. She can fill it out there, and then everything will be submitted online for you.
Thank you. Thank you. Today's share very, very helpful. Thank you.
Thank you.
Thank you, everyone. Thank you, Pearl. Have a good day.